This video is a short primer of how the Surveys of Healthcare Experiences of Patients, or SHEP family of surveys based on the Consumer Assessment of Healthcare Providers and Systems, or CAP surveys, can be used to provide the patient's perspective for improving healthcare quality. The SHEP family members include 4 surveys in specific areas: ambulatory care, or PCMH, recently discharged inpatient care, specialty care, and care in the community. But first, healthcare organizations can and need to be viewed from a systems lens, much like clinicians view patients as a whole and not as one specific organ. When patients have problems, multiple pieces of information are used to formulate a differential diagnosis. For example, a patient with chest pain in the ER will be evaluated in a number of ways. The doctor will ask about symptoms, obtain vital signs, and labs to begin to understand what's happening. An EKG will likely be added to the data pool to see if there's an active heart attack. This collection of information will give clinicians a better idea of whether the patient is having a heart attack, pericarditis, costochondritis, or another problem. Synthesizing collections of information to understand the depth and breadth of organizational problems is called triangulation. Similar to the approach for patients, the SHEP family of surveys are like labs. They provide data to understand parts of an organization's health in a particular area. This data can be triangulated with other data like wait times, staffing data, direct observation, talking to patients, and much more to generate a differential diagnosis, or hypotheses about how to improve locally. One specific way to make this data actionable is to use the SHEP Attributable Effects Report, a probability-based analysis of the ambulatory, inpatient, and specialty care surveys that reports impact drivers in 2 components: potential, or where to increase efforts, and maintenance, or where efforts should be continued. The report organizes the data by facility and survey question, or driver, rank ordered by potential areas. Potential is defined as the proportion of affected patients who are not currently satisfied with their provider rating, but would become highly satisfied if this driver were improved. Here, the top potential driver is care transitions. Maintenance areas can be thought of as drivers that are currently being done well, but would become an area of dissatisfaction if not maintained. Here, the data shows that patients report feeling that nurses really cared about them and is an important area to be maintained. Key drivers such as care transitions can be linked to areas of action. Here it's inpatient care with other data like conversations with patients. Triangulated data can then be made actionable by starting conversations with colleagues. Together, hypotheses can be generated with small tests of change, which can be done to improve patient care and our organization as a whole. In short, with a systems lens, the SHEP family of surveys can provide the patient's perspective, cultivate conversations between colleagues, and formulate hypotheses using triangulations about how we can improve quality within our system. For a deeper dive, you can view an in-depth video called SHEP, a field guide to understanding veterans' healthcare experiences, view your local VA reports, or view the CAPS guides at these links.